Hello, everyone. So this is going to be my case study on one of my athletes, Lawrence. So just a brief background on him. He is a 93 kilo lifter, has a pretty large deadlift on him. And so with this case study, I'd like to explore how we tried to progress it. So we're going to start from block 2 here, just to give a bit of context. With Lawrence, he came into this block with a bit of nagging knee injuries. So what we had to do was I had to slowly reintroduce him back into his original workload, which was about 6 reps here. So he used to do a top triple followed by 3 sets of 6. So by the time we get to week 3, he's back and tolerant to load again in that 3rd week. But in the first 2 weeks, it was a slow build up with a repeat of weights. This was a selection by him. I asked him to repeat these loads because I wanted the focus of the increase in 3 reps over 3 sets to drive the progression here. And then by week 3, he's back up to his original workload. So this is his secondary day. On his primary day, he's got a top single followed by 3 sets of 3. Again, slowly bringing him back up to his original workload. So in his previous block of the first one, he did quite well. I just wanted to build upon the things that I learned, which was this layout with the secondary day being on Tuesday and Friday being the primary day. It worked well. He didn't fatigue too quickly, and he actually peaked around week 6. And so this time around, going into block 2, I decided to give easy straight sets here to prevent him peaking in his top end strength on the secondary day. So by the time we get to about week 4, he's starting to peak in strength again. Pulls 275 here from 265 the week prior. Then pulls to 85, which is 10 kilos up from block 1, sorry. And then finishing up around 227 and 212.5. Yep, before he needs a deload here. So he gets sick in this week. And so we kind of pull the plug on the block by the time he gets sick, which I remember from off memory, he gets sick late in the week. So we can't perform. So the main things that I wanted to note is this layout works and we can continue to make strides in this way. However, I did not want this layout to stagnate. If I continue to repeat this, eventually it's going to stall and we can't make progress on it anymore. So in my following block with Lawrence, I've named this 2.5, just to note that it's a very similar iteration of what it is to the block prior. So if we look at the 2 days of sumo deadlifting, I've changed it to a top double followed by 3 by 6 again. This time noting that I've capped his load similar to what his peak strength would be going into block 2, the previous block. So we start at a higher baseline and work our way up to what it was previously and no more. And I'll explain why after. So he works up to 225, which is only 2.5 kilos less than what it was to his top end strength, and 215, which is 2.5 kilos above his top end strength here. I did want him to get a bit stronger, hence why we've pulled it only just 2.5 kilos here. Now, if we look at Friday, he had the top single, and now I've added an extra set here, just so then we can continue to make progress and he doesn't stall due to him tolerating the amount of dosage that we're providing him with the block prior. So the way this works is I've provided the 4 sets, and it helps that I've capped his load similar to what it was previously, because if he was getting stronger based off the Friday's workload, the increase in sets there, he should theoretically be able to perform on this Tuesday. And therefore this number should spike up if I let him off the leash and provide him an RP prescription. And so if we provide a percentage-based prescription here, capping him at what he would have peaked at previously, as well as including the slight increase in workload here compared to previous in the block prior. This would theoretically allow him to perform back on the Friday again. So we get another big change that I made is in week 3 to 4, I believe. So we get to week 3 here, and this is his peak. So in the following week, I've dropped his sets here. This is just because of in the 2 previous blocks I worked with him, block 1 and 2, he did start to notice some knee symptoms related to fatigue. So as he starts getting fatigued, he starts running into knee issues and it lingers quite a bit. Hence why in block 2, we had to slowly reintroduce him to the rep scheme. Hence, I've dropped it a bit earlier to allow him to not be so fatigued by the time it gets to the end of the block. In the sense of performance and also in the sense of health, because if we're spending more time trying to get him back to this original baseline, it's not worth it. So hence I've pulled him back here. And so what this is going to do is going to start to increase his ability to recover. And we can see it here on the Friday. So he goes from 277.5 to 286.5. And we discussed the following week that he's going to go on a business trip. So in week 5, we've planned this ahead. So he is very good in terms of communication. He lets me know when these things happen, so I can plan for the following week ahead of time. And so what I've done to account for the fatigue related to travel and work-related events, I've decided to keep the rep scheme the same, but drop the load. I don't expect this week to perform due to him traveling. And to be honest, this isn't too much of a drop-off in performance that I was expecting. But this day I wasn't too fast. I didn't overreact to the drop in performance from the week prior, because he also mentioned that he didn't feel fatigued or cooked in related to training. He felt a bit mentally drained due to just travel and work and things like that. This was a week-long event. Hence, off our previous data, we know that he peaks around week 6. And so I still wanted to bank on this in week 6. I do trust Lawrence as an athlete because he's quite a resilient athlete. So this might not apply for everyone. However, in accounting for the fact that we've pulled back here, I still allowed him to push this week 6 before we deload. And so if we go into the Tuesday, I've kept it the same again, even pulling the rep scheme just a tad even more to allow him to perform, especially on his primary day. And he comes into the Friday, he's top single prescribed, and I've allowed him to finish out the block, and he pulls a massive 315, which is huge. This is an all-time PR of about 15 kilos for him, I believe, off memory. Pulling 275 as a triple, which is also huge. So I think the key points is how we get to this point is 1, communicating with the athlete and pulling back as much as appropriate and not worrying about performance when these things arise, and if it also coincides with the athlete's mentality, but also the changes related to getting to this point. And had he not had this work-related schedule, I would have repeated the loads up top here. So if he were not working, I would have repeated the 225 and the 215 on this day, and expect a performance here, a progression, or if not a repeat. And then the following week, in retrospect, I probably would have dropped a rep still and kept the load the same. I didn't want to drop the intensity. I wanted to keep intensity as much as I could in there, but given the fact that fatigue started coming into the system due to just one-off occasions such as work, I thought it was an appropriate decision to make. Hope that helps. So after this week, he ends up deloading, and obviously by the end of the deload, after hitting a huge PR, he really needs the deload. Hence, I've taken out a couple of things to let him rest. But another positive, he did not experience knee symptoms here. So the fact that we also started to pull back a bit earlier resulted in not so detrimental performance and the need to climb back going into block 3.